April is Parkinson's Disease Awareness Month, making it the perfect time to talk about early intervention.
Annie Satowski explains the diagnosis and treatment options in this week's Medical Moment.
According to the Parkinson'S Foundation, 60,000 Americans are diagnosed with the disease every year.
It affects around 1 to 2% of those over the age of 60. It does become more common as we get older, and it happens a little more often in men than in women.
Dr. Ross Coleman, a neurologist specializing in movement disorders at Spectrum Health, explains what the disease is.
We lose a number of brain cells that create the chemical dopamine, and dopamine helps us move. So oftentimes one of the first symptoms of Parkinson's is slowness or stiffness or rest tremor.
But there are other symptoms to be mindful of.
Problems with acting out of dreams at night, anxiety, depression, constipation.
While there's no cure for the disease and no way to slow its progression, Dr. Coleman says there are a number of treatment options that they tailor specifically to each patient at Spectrum Health.
Things like physical therapy, occupational therapy, speech therapy, medications that can help you get moving a little bit better. And in some patients, surgical options, such as something called deep brain stimulation surgery.
Dr. Coleman says deep brain stimulation can improve quality of life in the right patient, comparing the surgery to a pacemaker for the brain.
So you have these small wires put in areas of the brain that we believe are involved in the creation of symptom in Parkinson's disease, and it puts out these little electrical pulses that actually improve the symptoms. So that can be programmed in order to optimize someone's functioning while minimizing side effects.
Spectrum Health takes a multidisciplinary approach to diagnosing and treating Parkinson's patients, offering a one-stop shop for everything they may need.
They'll sit in one room, and for half a day, they'll see a physical therapist and an occupational therapist and a speech therapist and a neurologist and a pharmacist and a social worker.
Dr. Coleman says early intervention and education is key to treating the disease, adding that exercise can help immensely. People
living with Parkinson's can continue to live very productive and fulfilling lives with this condition for many years.
Annie Satowski, Fox 17 News.
Spectrum Health offers a Parkinson's support group that now meets virtually. They meet on the third Thursday of every month from 6:30 to 8 p.m. You can send an email to the address right there on your screen to learn more.